Hello and welcome everyone, and welcome to a sip of coffee with WEN India on this Yoga Day. Today on Yoga Day, we are today on Yoga Day we are driving into an essential conversation about menopause and health. Let's sip and share and support each other on this journey. We are very thankful to Arogya Hasta Hospital for joining us today for this session. Welcome, sir. You are on mute, sir.
Good morning, all of you. Thank you, madam. Thanks for the given opportunity.
So stage is all yours, sir. Please take over.
Dr. Geeta has joined. We will just check
I think
once.
she is adding her device.
Ha. Yeah, madam is in her OPD, another cabin. I think she will join in some time now.
So what all services Arogya Hasta Hospital provides, sir?
Yeah. Madam, Arogya Hasta Hospital is a multi-speciality hospital situated at Kasavanahalli Road at near HSR Layout, Bangalore. So, Arogya Hasta Hospital, it is a mainly into orthopedic surgery center, and also we do have multi-specialty like gynecology. We have Dr. Geeta speaking about menopause now, and in the gynec department we have three doctors actually, including Dr. Geeta, Dr. Vishnu Vandana, and Dr. Arti Sharma. Three of them are there. And we have in internal medicine Dr. Hiranmayi Seshu. Next second session of menopause, Dr. Hiranmayi Seshu actually she will be talking about. And we have Dr. Uh, uh, another senior consultant we have, who comes in the evening. And we have general surgery Dr. Devendran, and we have orthopedics. Actually, we have got two of our consultants who does all ortho related sports injuries, all knee or even hip injuries all together. We have advanced center to do all orthopedic surgeries at our center. So we have been doing that. And we do all sorts of laparoscopic surgeries, including gynec as well as even general surgeries. All laparoscopic advanced surgeries we have been doing. And we do have all the services like even including ENT, onco, neuro, pediatrics, all the other departments we do have.
So,
Arogya
sir,
Asta
with
Hospital.
sports surgery, you help with the physiotherapy as well afterwards in
Yes,
sports
madam.
surgery.
Yes, madam. We do have
Great.
a physiotherapy as well. So, Mr. Dr. Vaisak and his team, they are there. They do for all the patients, actually, they do support them for physiotherapy. Post surgery, even instead of even sometimes even surgery may not be required for many of the ortho related issues, where physiotherapy directly can be taken and solution can be given. So many patients actually they do come for physiotherapy, maybe for back pain or maybe some sprains if they have. So they do come, and we have been doing that service. So Aragyasa, we do have even emergency care also. We do have two ambulances for patients. 24/7 ambulance is ready to give service to all the patients. We have even at emergency doctors 24/7 they are available. We have full-fledged diagnostics laboratory. We do all the ultrasound scans, including gynec scans and all the general scans together. At gynec scan, we have Dr. Shobha as well as Dr. Anusha. Both of them, they do give coverage for all the scans to be done 24/7, including early pregnancy scan, follicular scan, all the gynec scans including. And at diagnostics, we do have X-ray and even CT. Up to CT, actually 24/7, all the services are available, madam. So this is about Arogya Hasta Hospital. And one thing what Arogya Hasta believes in that to give a better patient care, individual patient care to all of them who are coming into the hospital, so that they can go happily with the expected result they deserve. So our hospital staffs, nursing staff, and we have got a skilled surgeons as well to cater to each and every need of our patients. Yeah.
So it was
So
very
until
nice
then,
to know all the details and the services what you are providing, sir.
and
Yeah.
another important thing, Arogya Hasta Hospital, actually, we do believe in even giving support to community as well. So we do have something called as a Bloom Initiative. Now, what we are doing now, the talk, it is the part of a Bloom Initiative. That means actually this is a Bloom. It is nothing but a women education program, madam. So many a times actually we have seen our patient when they come to hospital, when they see the doctor, afterwards when they come out of the cabin, they will always say that actually something left out actually, कुछ तो रह गया डॉक्टर से पूछना था. So normally it happens actually, and when they go back home, normally sometimes even they do call back again saying that something missed out. Actually, we want to talk to doctor once again. So it happens, and sometimes actually women, we have seen that because of our Indian culture, or however, they cannot express themselves freely. We could see such an from the we have taken feedback from many of our patients as well. Looking into that, what we thought actually to come out with such a women education program where such an issues actually will attend, will address that, so that all our patient, they can get the right information what really they want. So set short 1 or 2 minutes short videos are done, and these videos are there in our YouTube. So every week actually we are adding our such women education program videos into the YouTube, and we are requesting all our patients or anybody actually they can get the subscription, and they can send the queries, and they can send the topics in case if they want any further topics actually, in case if we have to cover it up, all that, so that it will be really helpful to many other people also surrounding who can get this information. So I will be sharing more details about our Bloom initiative later on, madam.
Yeah. So even for today's topic, sir, menopause is something what everybody doesn't talk about, and there are many
Yes,
ladies who are suffering with some of the symptoms, some uneasiness or something, but they don't feel that comfortable and vocal about it.
yes, yes,
So it is great luck of WEN India that you people agreed and you are going to talk to it. And if you have some suggestion like that, that people can go and see the videos on YouTube, that's also very good. So even after the session, people can subscribe to your channel, and the ladies can be updated and their queries can be solved. It's a great
yes,
initiative
really.
from you, sir.
Yeah, yeah, really. Thank you, thank you. As I rightly said, even menopause is the condition. Many times we have seen that ladies actually uh, they're not aware of, and many times actually they will not know the symptoms actually. So how it starts and when it starts, and whether I'm really feeling that when to consult a doctor if required. So they will not have this information. I think this awareness can be created. It can be told to them actually what all the symptoms they do have to look into. So when they have to see the doctor if required, and what support they need. So all that can be really addressed. And actually, in that
Because
way,
at
actually,
that time, I think that one emotional and mental support is also needed, other than only the doctor. That
exactly,
thing in mind that okay, somebody is there to support and talk about it is also a great help at that time.
exactly, exactly. Really, I do agree, madam. Really, I do agree. So here, thanks for the part second session that you have allocated for us, where Dr. Hiranmaya says normally what happens, as you rightly suggested, like until menopause, yeah, gynecology definitely can be taken care. And after that, maybe general medicine related, maybe diabetes, or maybe even come to hypertension, maybe come to thyroid. So many other things actually where a general medicine consultants, when they look into, they may have more concerns to address about it. I think Hiranmayi madam, the next session actually she will give certain tips actually which is really useful for many such ladies. So many a times actually definitely we do suggest not to go to doctor. So
Mm.
the the awareness program is really about that, to tell them so that they can be fit enough, they can be healthy enough, so take care of their personal life as well as even professional life both.
Mm. Actually,
I think
I
Dr.
think
Geeta is
Dr.
joining.
Leo, yeah.
She's still muted.
Hi, just
I
give
think
me 5 minutes, huh? I'll just
Oh,
join
sure,
from different
Dr.
device.
Geeta. Yeah, sure. So Arogya
Actually,
Hasta is there from how many years, sir?
Madam,
I'm
Arogya
sorry.
Hasta actually is just started about 8 months before.
Oh,
So 8 months before. Here, when it comes to the facilities or when it comes to the uh, uh, giving services to the people, actually, hospital never compromised on the quality. So we
mm,
have got all the best of the equipments, all the branded best of the equipments with us, and even our consultants actually they're the best we have taken, looking into their
mm,
expertise, clinical expertise, as well as their even the qualifications all that together. So idea is that actually whenever any patient stepping into the hospital, definitely they are sure about actually our clinical expertise and our quality care from our nursing staff, and the best of the OT and the best of the diagnostics we have, and the complete pharmacy 24% pharmacy coverage we have, and even we do have home care services also, physiotherapy as well.
oh.
Uh, so
It's a
this is how
one-stop solution for everything, I feel, sir. Because
exactly.
everybody is worried about the after surgery and all those things. Everything you are able to provide there.
Exactly, ma'am. Exactly. So we're into that, and another thing, what hospital, as I were telling, we believe in even creating awareness about health in the general public. We strongly believe in that. Yes, we are a healthcare sector. When people are sick, they do come to us. We treat them. That is always there. We do that on everyday basis to each and every patient. So, but
Mm,
our responsibility is that for general public to society is that actually we want to create awareness about the general health. Actually, the Bloom initiative, actually, this is the initiative actually especially only for women from the menarche, from the first menopausal, first periods that any girl
mm,
actually when she starts feeling, from that time until the menopausal time, or maybe majorly actually we'll focusing up to the age of the first childbearing time.
okay.
So when she becomes pregnant, and that is the most fertile period actually, and that is the time many of the women have we have seen that when patient when they come to our centers, they will have lot many issues, maybe with their
Mm,
monthly cycles if it is not regular, maybe PCOD or maybe fibroids, lot many such things actually. So where they are not aware about what is happening to them, and what is to be done. And solutions
mm,
are very simple actually. Solutions are very simple, and it should not
mm,
be neglected at the earlier phase of the life. So what we do in the Bloom Initiative, madam, we are going to schools, colleges, corporates, and even NGOs. We are creating awareness from the childhood days itself, actually, not only to the children and to the teenagers and to corporate women working, even for the parents as well. Actually, here the major role is placed by the parents, I think so. The more
mm,
patients they know about how to take care of their child at the early age
mm.
itself, so later on, actually, the child will not have grown-up issues. So
Yeah,
that deserve actually even, for a corporate sector, so they are also get benefit. Like if their employees are healthy and if they are fully functional, and even they'll be more productive at their workspace also. So because of
absolutely.
that, yeah, and many women actually, as women, Indian women actually, it is always a challenging actually, because you definitely you will know
Mm,
that. So you will have to balance work life as well as even the work life both. So
correct,
when you
correct.
keep yourself very healthy, and when that healthy awareness when it starts from early childhood days itself, though
Mm,
आगे जाके actually ऐसा problem नहीं होगा actually. Many women actually will not have these issues when they get married after that.
mm,
So looking into that, actually our women education completely it goes into that. It is totally free of cost. We are not charging for that. So we do
mm.
such many such programs we are intended. You can also go and
I
suggest
think
us, madam.
post-COVID also people have become more aware of their health, and being healthy, it has to be a habit. It should not be a part-time thing. What in month we can have 2 3 days where we are dedicating it to the health. It has to be incorporated in the daily life.
100% true. 100% true. Actually, as you rightly said, post COVID, the much awareness has really has come in.
Yeah,
It was we cannot help it actually. Younger group actually they go for outing and junk food. it happens actually, unhealthy lifestyle. So it happens, we cannot avoid that, and we cannot tell them not to do that. But uh, but creating awareness, actually somewhere actually they can control on those habits, they can have control on those habits,
Yes.
and how much to eat and what to
They
eat.
should know where to stop. Huh. They
Exactly.
can choose the food, and they should know where to stop as well.
Exactly. So that awareness is very important. But nowadays, I see that a younger group, they are much, they know about physique, their physical appearance, and even their communications and their style. Really, I see that in the younger generation, actually, they are more inclined towards it, and they want to learn more about it. They want to practice that. That's a healthy
I think
thing,
this
really.
is one thing positive about this Instagram and social media, that these kids have become more aware about the health, because they, other than other reels and all, they see these kind of reels as well. So that is one thing positive about it.
Yeah, really, I should appreciate that social media in that way. As you rightly said, actually, any media platform can be taken how we see that. So that a positive attitude and the right thinking is very important in youngsters nowadays. That is very much important. We see that every day in TV channels and the newspapers. It is really sad to see actually certain news when we see that. That is the reason in schools and colleges, normally we have seen that in curriculum they don't add these issues, madam. They don't address these issues. And we cannot blame them because they are more about their curriculum, and they want to complete the study materials. They will not have
Mm.
time, and tuitions, and after that, all that.
Mm.
But somewhere actually, at least in a week, at least 1 or 2 hours, if they spend that time for students, where educating them or maybe empowering them, uh, so for their mental health, and if they really somebody can talk to them actually, how are they going through and what issues really they have, whether do they need additional support. I think this sort out many issues. I think so.
So,
I think
sir,
that
while we
is.
are waiting, I have already got one question. I will wait for Dr. Geeta later on to ask that.
Huh.
There are, I have got one question. She's saying there are sometimes we feel menopause symptoms early by age 28, 29. So I think Dr. Geeta will be better to answer it, but
Yeah, better. Yeah.
already started getting the question, so I'll get it added later on.
Yeah. I think Dr. Geeta is better to answer that.
Welcome, Dr. Geeta.
Thank you so much. I'm very
Yeah.
sorry. There's some technical issue.
That's okay. Being online is a facility and it comes with some disadvantages, so technical issues and all. But I'm very thankful to you, Dr. Geeta, for joining us today. And a few days back, I was also watching Instagram, and I was looking at the reel where it said that ladies should take care of menopause as a challenge, not as a challenge, but as a part of life. Like the teenage has come, same way the menopause is there. But what I feel there is that reel was said in a very easy manner. I will not contradict to it, but I will like to add my point to it that when the baby is born in a family, whole family is very excited and very helpful in that way. And so to growing up a new infant, it's very easy because multiple hands are there. But when menopause comes, and it is something which is being dealt with a woman, and that time people are not that excited to know about it. So if
Yes.
that type of environment is provided at family, if it is easy to say that a woman should take it as a new birth and all those, but it's actually not a new birth for others. So that
Yes.
excitement and happiness with others is not there. So it becomes a challenge with the woman.
Yes.
So
Yes.
that's why we have,
Actually,
yeah,
that's what, like, we as gynecologists, we have to create that awareness, and we have to educate the people, especially
yeah.
the women, and even,
And
their family members also,
yes, and
regarding
in
the
India still
menopause,
it's a
that it's
taboo to talk
normal.
about
Like,
menopause.
it's a
Not
physiological
everybody wants
phase,
to talk
it's a
about
natural
it
age.
because it's connected to aging and all. So that's again two things which we should be focusing, that ladies should be relaxed in that points. So I will request you to continue with the session. I'll leave the stage to you. Yeah, you are audible,
Yes,
Dr.
yes.
Geeta.
Shall I
Yes, yes,
introduce
just
Dr. Geeta before we start?
Yeah, please, sir. You can introduce Dr. Geeta.
Dr. Geeta, welcome, Dr. Geeta. Good morning, madam. Dr. Geeta is our gynecologist and a full-time consultant at Arogyastha Hospitals. And Dr. Geeta is a gynecologist, laparoscopic general surgeon, and also fertility specialist also. Madam has got more than 10 years of practice and vast experience in treating women in many other categories that you see, maybe surgeries, fertility, or maybe even in pregnant ladies as well, and even many menopausal women as well. So, I welcome Dr. Geeta. Madam, you can take over. Thank you.
yeah. Thank you so much. Thank you so much, Moon, for that kind words. Yeah. So I think we're on. Yes, we are already online, now. Right. I don't think I can share my slides. Yeah, that's okay.
Yeah, you can share your slides, ma'am. There is a present button if you want.
No, it's okay. It's okay. I'll just talk. Yeah. Right. So we already know that we'll be talking on the menopause. So what is menopause? Why we have to know about this menopause? How is it? How is it important? What is the significance of it? So I'll be just briefing on this menopause today. So we all know that it's like the life starts begins at 40, so for the women especially, because that is the transition stage wherein the women experience uh, different things in her life, especially emotionally, physically, and mentally also. So we have to take care of all those things, and of course not only the women, the family members, friends, everyone should support her. But most of the women don't even talk about it because it's a taboo, that it's been since a long time in our Indian scenario especially, that we should not talk about certain things, especially the women should not talk about this puberty or menarche, what is bleeding, heavy bleeding, or even the sexual, regarding the sexual health, regarding the vaginal health, and the same way even the menopause also. So people think that the society thinks that okay, this is not good to talk about it, and so accordingly even the ladies or the women also feels that okay, it's not good to talk about it, but they will be suffering from inside. So whom to address these issues, they won't be knowing, and obviously they will face a lot of challenges in life after 40. So that is what that the transition stage, what we say, the perimenopause thing. So why we don't talk about the menopause? Because it's already like women are, since the beginning women are used to suffering to this, right? And often they place themselves as second. The family will be in the first, and the second will be the women. So whatever the things they will do, especially for their family. So priorities, the priority will be the family, and then comes the uh, women herself. And also they don't know whom to talk about these issues, and they don't know whether the solutions are available or not, and they even think that okay, this will just pass. And finally, even as I already told, the family or the society, they are not even aware of this entity, and that's why they won't get that support from the family. So what is happening within us, right? So because of which there will be lot of impact in their personal life, sexual life, and even in their professional life or the work life. So majority of them, the transition stage, what we say that 40 years, right? So we say that it's a perimenopause. Perimenopausal stage is nothing but it's 3 to 5 years before women attains a menopause. Usually the women experiences lot of lot of mental stress. Of course, we'll talk about the symptoms in the later thing, but the experience is like they won't be able to concentrate on their work, right? And they will feel tired or weakened uh, as early as possible. Like they won't be able to do the things which they were doing the things earlier with that great enthusiasm, okay, and with that great strength. They won't be able to. And even a lot of people even start having a lot of mood changes. They will feel irritated, they will feel sad, and they even try to lose their memory gradually. They are tend to forget the things. So these are some of the things which the changes which undergo in these women in their perimenopausal stage. So why is this menopause so much significant? So the lifespan of a woman has increased from 23 years, which was in the Roman era, to 65 years in India and 80 years in the Western countries. So almost like one third of women's life is spent after menopause. Though the age of the menopause is constant, like what we say around 45 plus years, the women attains menopause. So that is constant, but the life after the menopause, that has increased. So why it is significant, why we have to know about this menopause? Because if we are educated and if we are aware of what happens during menopause or post menopause, we can, the women, okay, can recognize the symptoms early and they can seek the medical help, okay, and also they can support the other women also. So that is the significance of this. And so let me just brief like what is menopause. So menopause is nothing but usually people say, okay, periods will stop. Yes, of course, it's the permanent cessation of the menstrual periods, right? So we can have natural menopause and surgical menopause. So natural menopause is nothing but permanent cessation of this periods for 12 months without using any contraception. And the surgical menopause is, some women do undergo some kind of surgeries for some diseases wherein both the ovaries might have to be removed, or in cases of some cancer they might undergo some chemotherapy or radiotherapy, or even in cases of premature ovarian failure. So in all these cases they attain menopause, may not be naturally but because of the surgical thing. But one more thing is, whichever women undergo hysterectomy, that is removal of the uterus without removing the ovaries in their perimenopausal age. So when the ovaries are there, of course the hormones will be acting. So either one ovary will be sufficient. So if they have removed one ovary and the other ovary is there, or both the ovaries are still conserved, then of course uh, you know menopausal symptoms may take some time to appear. Okay, so this is about this menopause thing. And at what age does a woman typically reach menopause? So it ranges from 45 to 55 years, and in the Indian scenario 40 to 48 years, while in the Western countries it may extend from 48 to 51 years. So almost around 45 to 55 years is what we say. So what are the symptoms? So when a woman attains menopause, so what are the symptoms uh, she can experience? Okay, so one will be usually hot flushes. Okay, so the women will be like having lot of heat producing from her body, especially during the night, and it might last for 30 seconds to few minutes also. So that is one thing. And night sweats along with the hot flushes, and even some women gain weight, especially around their belly. Okay, that fat, belly fat will be increased. And mood changes, as I already told. So mood changes includes, they will be like irritable, sad, happy, don't know what to do. They'll be like feeling helpless, and even low sexual drive, and they even have vaginal dryness, because of which there will be itching in the vagina, discomfort in the vagina, and even pain while having intercourse. And even they experience some urinary problem like incontinence, stress incontinence, or even urge incontinence. So they'll have sleep disturbances. So they'll be sleeping around say like before this period, but after 40 years, slowly they will start sleep deprived, not able to sleep. And even they'll some might develop headache, migraine, backache, and some might even have hair loss, and some might even have excess hair on their face, especially over the chin, and even muscle and joint pains. So these are some of the symptoms usually a women experience uh, in and around menopause, or even after postmenopausal also. Okay, so even if these things are not treated accordingly, depending on the severity, so there are some long term effects like osteoporosis, heart disease, Alzheimer's disease, all these things. So what happens in menopause is actually the hormone, that is the estrogen hormone, which is a bit which is helpful for the women, it will start decreasing, because of which we experience all these symptoms, especially vaginal dryness and urinary problem, then mood swings, hot flashes, joint pains, backache, all these things. So, of course, once this estrogen decreases, even the bone density also decreases, calcium decreases. So, because of which, majority of the women start having joint pain, back pain, tiredness, weakness, all these things. Okay. So, what can you do? So, what we have to do for this? So, we have to get educated ourselves, and we have to create awareness, and we have to take support. We should not just leave it like that. So, because some people definitely in this digital era, there are a lot of things coming up in the internet. So obviously, people who are in the cities, they will be reading about this menopause, perimenopause, what is happening, all these things. Of course, to some extent, it is okay, but definitely the first person to contact will be your gynecologist. So I don't say that you should not read about it, but read to certain extent. But whatever help you need, so the first person to contact will be your gynecologist. Of course, you should seek a professional help. Okay, you should not um, you know take care of all the things on yourself, because that won't be possible, especially at this transition stage. Okay, and then so what are the things we can do during this menopause? So as we say that when can a woman attain menopause, so some people will be discussing about all these things. So it all depends on, so what are you doing in your age of around 25 to 30 years. So, how is your lifestyle? How is your stress level? So, lifestyle includes physical activity, either exercise or walk, and even the diet. So, how are these things in your life? So, if these things are good, so then definitely after the age of 40, 45, definitely you will have a better life. But initially, if you're not good enough in your lifestyle, so majority of the people might experience severe symptoms, and they might need a holistic approach for this. So definitely it is our responsibility as a gynecologist, it is my responsibility to create awareness and educate the women who are in this age group, or even their children whoever are watching this video, so you can spread this word, okay, to your family members, to your relatives, to your neighbors, uh, to all the women basically. So what are the lifestyle modifications required? So the key points I would just mention. So regular exercise is advised to reduce the cardiovascular and cardiovascular diseases. Optimal exercise, at least 150 minutes of moderate intensity per week. And the intensity of aerobic activity should take into account the age, the gender specific. And the weight loss of 5 to 10% is sufficient to improve any abnormalities associated with this metabolic syndrome. So smoking should be avoided, and avoid alcohol, avoid caffeine, and also a healthy diet should include several servings of fruits, veggies, and whole grain fibers, and even you can have fish at least twice weekly, and low total fat, and of course salt, as I already said, salt, alcohol, smoking, all this should be limited. So other things includes, the socializing and being physically and mentally active. Socializing in the sense, uh, talking to your family members, or talking to a group of women of your same mentality, okay, and getting into some creative things, so that you'll get yourself busy and your brain won't be unused. Okay, so you should get into some creative activities. Okay, and of course, as I said, uh, physical activity which includes exercises, aerobic, you can even go for zumba. Okay, so it all depends on your age, and what is your symptom severity. And definitely you should consult a gynecologist. And of course it doesn't involve only the gynecologist, because some women, as I said, may develop cardiovascular diseases or even osteoporosis, all these things. So of course the gynecologist may refer them to either endocrinologist, orthopedician, physician. Okay, so a lot many people will be involved in this. It's not only the gynecologist, but of course the first person to contact easily will be a gynecologist. So we have other treatment therapies also. Okay, so the hormonal therapy and the non-hormonal therapy. And hormonal therapy, again, your doctor will decide whether to put you on any hormonal medications for your symptoms. Okay, and the non-hormonal usually will be the calcium and the vitamin D analogs and phytoestrogens and some bisphosphonates also. So that is why usually we say, like, menopause, perimenopause, or even the postmenopausal women, at least take calcium, either the tablet or in the food also. So at least 2 to 3 months calcium tablets in a year. So almost every day for 2 to 3 months in a year, so that uh, you will prevent osteoporosis in the later stage. So I said phytoestrogens, which are easily, like, you can replenish with the food. So which are the food containing phytoestrogens? So you can go for carrot, tomato, soya beans, apple, plum, then peas, cucumber, cherries, oats, barley, dates, wheat, all these things, and also fermented foods like idli and dokla also. And so basically you have to uh, enhance your fruits and vegetable servings in your meals. Okay, so so many people will ask, so we have attained menopause, so is there any checkup to be done, right? So definitely yes, I would suggest, once you attain menopause, better go and have a health checkup, which includes your BMI, then breast examination, then your blood pressure, and certain blood tests also. You can even undergo a pap smear test, that is a cervical screening test, ultrasound, and even the bone mineral density test also. Okay, so at least once a year. So we have to live with this. This is not exceptional. Okay, so we have to be living with this menopause. So cherish this life, don't get into depression. Of course, I have come across some patients who will be very much depressed. Of course, some these kind of women where there is no support, okay, from the family or even from friends, because they won't be able to speak out all these things. Whatever is happening in them, they won't be able to speak out either to their family or husband, friends. So they will actually um, experiencing that pain within themselves, and they will gradually get into this depression. Of course, when they get into this kind of things like depression, okay, sleeplessness, all these things, definitely we need a psychology counseling or even some psychiatrist advice also. So you have to uh, cheer yourself. So it's not a very sad phase of life. Okay, so you will be happy that some people will be happy that okay, we are free of this monthly periods. We don't have to use the sanitary napkins or a menstrual cup, all these things. So everything is free now. Okay, some people will be happy about this, but at the same way some people will be sad. Okay, their youth is already declining. So either of the things can happen. Okay, so maybe like better I would say that after 40 years or after 40 years, so lifestyle modification, which includes exercise, aerobic exercises, even yoga, and even go for meditation also, and healthy diet. These are the main things. So if we have any questions.
Sorry, I was on mute. So yes,
Yeah, yeah.
Dr. Geeta, we have received some questions. They are appearing on the screen. Are you able to see them?
Yes.
This first one is body cramps. How can I solve?
Okay, she's what is her age? Like, anyway, menopausal body cramps, as I said, they will have all this leg pain, muscle pain, and even the body cramps also. So mainly you have to get yourself tested, okay, and as I said, add some fruits, vegetables containing vitamins, minerals, okay, and talk to your gynecologist. So that definitely it will help. At age 28 also I feel symptom. My gynae said hormones are near to menopause, possible in this age. 28 years, unlikely, very much unlikely. But definitely before your periods, premenstrual symptoms, which includes mood swings, that again, that irritation, okay, and some kind of bloating, all these things will be there, okay, and even the leg cramps, all these things will be there in the premenstrual, okay, because all these are because of your hormonal variation, which usually happens during the menstrual periods. But if it is severe, you have to get evaluated. My daughter get her periods every 15 to 20 days. Will she get menopause early? I won't say like she will definitely get menopause early. Again, it's a rule of thumb. Like whatever age the mother has attained the menopause, usually the even the daughters will also attain around the same age only. But here, 15 to 20 days periods, you have to get again evaluated by your gynecologist. What is the reason for this? Get it treated, okay? And of course, as I said, usually the periods menopausal age will be around 45 years, 45 plus. Every 2 to 3 months, okay, she get her periods. Will she had harder time for menopause? Not harder time, I would say. Of course, all the women experience these menopausal symptoms. Severity may vary. So from now itself, if your daughter is around between 20 plus 25 plus, okay, let her have a proper routine. Get into a proper routine. Again, lifestyle. Okay, so once these things are fine, then definitely during the menopause, whatever the symptoms, severity, it might reduce. Is endometriosis because of menopause? No, not actually. Endometriosis is a different scenario actually. Taking hormonal injection during pregnancy cause hard menopause. Hormonal injections during pregnancy. Okay. You meant some progesterone support or something. Yeah, I would think like that. No, I don't think so. No, I want to know what is like hard menopause. Maybe like the severity of the symptoms will be severe. That is what I think it meant. But no, it's not like that. During the pregnancy, if you're having a lot of injections or tablets, all these things, you will your menopausal symptoms will be severe. No, I don't agree with this. See, after the pregnancy, you'll have a lot of time to reach the menopause. So set a routine, follow it, follow a good routine in your life. Okay, go for gym, go for a walk, go for cycling, go for swimming, maintain your weight, and have a healthy diet. So definitely your menopause will be smooth. Vitamin D, calcium, iron. uh, what else to eat? This is sufficient. Along with this, with your food, in your food, of course, you have to add some vitamins, minerals, all these things. But otherwise, these things should be fine. As I said, calcium at least 2 to 3 months in a year is advised. Of course, iron, depending on your hemoglobin, okay. If it's less, you can go for some iron tablets. Along with that, even in the food also, you can add some iron containing food like green leafy vegetables, then pomegranate, beetroot, dates. Anxiety attack and hot flush. I trouble a lot. Okay, ma'am, I think you should go for a professional help. That is, go and meet your doctor, go and meet your gynecologist. They will be the better person to assess you and give you a solution, definitely. What test to know the menopause start or end? Okay, see, before the menopause, that is perimenopausal stage, wherein it lasts for 3 to 5 years. Okay, so in this stage usually the periods will be irregular. Okay, you might have less flow, and even the periods might come to every 2 to 3 months, or some may have this heavy flow also during the periods. Okay, so this may last for 3 to 5 years. But then if it's a heavy flow and all, you should not just keep quiet because it is just because of the perimenopausal it is happening. No, seek the advice from your gynecologist and let them decide, okay, whether it is the perimenopause or because of the perimenopause or because of any other issue. Okay, and okay, so once you attain the menopause, that is 12 months, you won't get your periods. You're not using any kind of medicines or anything, and 12 months you don't get your periods. So that is when we say that, okay, you have attained menopause, and following that, usually hardly you will get any kind of periods. Okay, maybe sometimes you might have some spotting or some bleeding once in a while. Okay, but then as I said, go for a health checkup. Of course, we do some hormonal tests to assess whether the menopause, you have attained menopause or not. So, what is the normal variation in period cycles post 40s? Period getting delayed in few days is usual, but if the delay is more than a month, is this normal condition or not a normal condition? Yes, as I said just now, I said yes. Some people they do have this variation, delayed periods every 2 to 3 months once they will get their periods. So, if you're so much concerned, better consult your gynecologist. Have a checkup with them at least once, okay, and they will be the better person to explain to you. And of course the flow it will reduce because the hormones, definitely the estrogen hormones will keep on declining once you attain this menopause. So definitely in the perimenopausal stage, of course the flow might reduce.
Thank you for that insightful details and very patiently answering on the questions also, because these are the some questions what we once we circulated about the event we have received. So
Yes,
still, as you said in the beginning of the session, menopause is still a taboo, so not everybody feel comfortable to post in their name.
yes, definitely, that is what I said, we should actually speak. Then only a women can seek that confidence, or rather they can seek that kind of solution for her problem. Otherwise, I have seen many people, they will just come to my op, and again in the perimenopausal age only, and while talking to them only, I can understand what is happening in them, that kind of mood swings, irritability, anger, and they are like helpless. They'll be like, though their spouse will be there, because of so many issues have happened also because of these changes in their body, and even physically, emotionally also. Some have even gone up to all these fights between the spouse and all, right? And even they might go for the separation also. So definitely it's not only the women who has to get educated and get awareness of this, definitely their spouse, their family members, friends, right? So whoever are watching this live, definitely I would suggest them to spread this awareness to your daughters, okay, to your family members or to your neighbors. Definitely, like, there is a solution for everything. There's a solution
And
for
I think
everything.
there should be acceptance that they are aging. That
Yes,
acceptance is very much necessary.
that is why I told, like, you have your group. You have your group, like maybe like you will be having your friends group, school friends or college friends group, which are there for a long time. So continue that, or get mingled with the people. Get mingled with the people and talk about it. Then only you can express yourself. Then only other people also get that awareness from you, if you know certain things about this menopause.
Yeah. So what I have heard with my friends as well, that at times they are not comfortable to visit the crowd because they are not sure about their bleeding time and all. And sometimes when they are visiting some place and suddenly they get some bleeding, heavy bleeding, and then it stops and all. Some episodes have happened. So they, I think that is the point where we are saying, asking them to go out and meet, and that is the time they don't want to go out because their dress can get dirty or something like that. So
Yes, yes.
that
See,
difficult to understand that, but I understand what you are saying, because once they go out, definitely their mood will improve there
yes,
talking to others.
definitely. Because if at all, if we see, normally a person, if you're not talking your things to anybody, if it is, if you're keeping it within yourself, of course it will build up, build up, build up, and at once, you know, you'll, it'll blast. Or some people might go into depression also,
Hmm.
right? So many people, they have gone, the cases have gone to such levels.
So, ma'am, like for pregnancy, also they say post-pregnancy depression. So, is there something like post-menopause depression, and then it recovers after a few years or months, something like that?
Yes, yes, yes. That is what I said. Those who are like menopause, or even during the perimenopause, they will start having the symptoms: hot flashes, all this irritability, and some at some point of time they'll be happy, and some point of time they will be like very sad. They will be knowing that difference. Okay, or even their children or the spouse will be telling about those kind of differences. At that point of time, if they are not going and seeking any help, okay, then definitely it gradually increases, and at one point of time definitely they will get into that depression. They will be in that stage of depression. Maybe that severity varies of the depression, but they will be in that stage of depression, and definitely they need some kind of medical treatment.
Mhm.
Of course, with the medical treatment under proper guidance, all these symptoms, okay, it can be solved.
Mhm.
They will have a better life. Because otherwise what people will say, okay, if I go to the doctor, if I tell all these things, they will just write some medicines. Okay, you take this medicine, that medicine, and all. How much medicines I have to take? Again, it will be the same thing. If that mindset is like that, okay, then definitely they won't seek any help, and it will be a problem for them and to their family itself. So
Yeah, I
basically we
think
have
the broad mind
accepted.
is needed to accept that change in life and the
Yes,
aging also. And
yes,
definitely the conditions will be there. Everybody has their own conditions. We don't
yes,
comment on that. But
yes,
yes, if friend and circle is there, it can be handled better way. And we definitely are there if anybody has any more questions to ask. And
yes,
so
yes.
I thank Dr. Geeta for today giving us the time today. And because it was a yoga day, so we thought that it's very much better to talk about some health related issue. So let's not do yoga, but talk about something which really women wants to talk about. And
Yes,
that's why we
yes,
kept in the morning hours. So Friday evening they might be busy, but yeah, Friday mornings they can give it to themselves.
yes, yes, yes. One more thing is, again, as I said, like, in lifestyle modification, they have to, start something new. If they have not done anything, at least they have to start something new. At least go with yoga. Since it's a yoga day today, at least, they have to start with some yoga at least, right?
Keep
Some
the
physical
excitement
activity.
maintained.
Yes.
Yeah, if it is okay for both of you, can I add up something?
Yeah,
Ah,
yeah,
yes,
please.
yes.
Yeah. Yeah, Geeta madam, Vandita madam, one thing I wanted to know, with all the discussion happened, I have seen some support groups actually. These support groups are done in different areas for different specifications. It is done, and where there are clinicians are definitely there, and even many people actually who are suffering. Maybe if it is a menopause group, many people actually related to that actually they will be in the group, and people actually they do come out with their own ideas how to come out of that, and they give such an ideas actually who are really suffering actually, as you rightly said madam, many a times it happens that because of our culture, or maybe whatever the lifestyle actually they could not be able to express themselves, and these groups actually they will come very supportive for such women who are really suffering. Forming such a groups and involving people actually who really want such information to help them out, will it help madam? Just I wanted to know.
Yes, definitely. Definitely it will help. Yeah, because see, uh, the people who are facing the same issues, right? So if they come up and if they have some guidance uh, for that group, okay, definitely they will have some help. They can seek some help and they'll have a better life.
Yeah, Vanita madam, what do you
I
feel,
think
madam?
there are
Any
two benefits. Uh, yeah, I like to add there. I think there are two benefits for such groups. First thing is we feel little relaxed to see others in the same trouble what we are in. So we
exactly?
feel like, okay, there is somebody else also suffering like us. So we get a little relaxation. Second thing is people want to talk about it, but they want to keep it private as well. They don't want to talk about it in public. So you're talking in a WhatsApp group will be a private conversation. So it will give them that comfort to share the things what they are generally not able to share in the public area. So I think it's a great idea.
Yes, yes.
Thank you.
There
I
is
hope I have given,
again,
yeah, I hope I have given a
yes,
little insight of regarding the menopause thing. I think it'll be useful.
yes, in a very comfortable manner, ma'am. You have suggested multiple things, so it was very relaxing. And at times the doctor's voice is so soothing that we feel that we are half cured. So something like that went with you. So,
Thanks.
so thank you for joining us. And
Of course,
we are
actually,
facing.
it's a vast topic actually. So if we get into the details of this, particularly the lifestyle changes, okay, all these things, definitely we have to take one more session. Maybe I think that Dr. Hiranmai, madam, will be talking about those things.
Yeah. And if we see, ma'am, that there are many more inquiries, and as ladies prefer a little private session for that, we may also request you to have one private session on a Google Meet or somewhere where the ladies who are interested they can join the session.
Sure, sure, definitely. You can let me know.
So, as a appreciation to Arogya Hasta Hospital, we wanted to play a clip, but there is some technical fault, so we are not able to play. So there is some
No.
delay in that.
Yeah, we can
We are just
discuss. Sure.
trying to do that clip. Yeah, just
No,
give me
no,
a
no
few
issues.
minutes. It's still
Yeah, yeah. Otherwise, actually,
in between. If,
yeah, yeah, yeah. Otherwise, we can close. No issue. Whenever you're comfortable. When we take the next session with Dr. Hiran Mayamana, we'll go ahead with the video, madam. No issues.
yeah, and post this session, we will because we want to thank you, Arogya Hospital. So we will post the video on our Facebook. So we suggest all our viewers also to watch it. And thank you, Dr. Geeta, and thank you, sir, and thank you, Hasta Hospital, for joining us today and conducting this useful and informative session for our members and for all the ladies around. Thank you.
Thank you so
Yeah, thank
much.
you. Yeah, thank you. Before we close, any issues, any queries, or any doubts, if it is not clarified, still if it is remained, and after somebody want to ask, actually they can always reach out to you, madam. You can message us. Geeta, madam, if it is okay for you, maybe in the next session, or maybe we can just have a session with the idea is of Arogya Hasta is, madam, not only to give clinical treatment, and our responsibility for the society is that we do such awareness programs. Idea is to have everybody to have their healthier life, as Dr. Geeta was rightly telling. At the earlier stage itself, actually, if they know their lifestyle, healthier lifestyle, it is good for them in their future life also. Thank you.
Yeah, true, true. Thank you.
Thank you.